What's going on, everyone? Happy Tuesday. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. And if you had to take a test for any other virus, I hope you have tested negative for that as well. But if you are positive, I hope you have a full and speedy recovery. It is time now for the Tuesday edition of the Virus Update for Tuesday, January 21st, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update as needed on all those viruses that can make people sick and animals as well, because bird flu has been a thing as of lately, and it's something that we continue to monitor pretty much each and every day at this point. So want to stay informed with what's going on with these viruses? Subscribe down below. Give this video a thumbs up. The more people that hit that thumbs up button, the more YouTube is going to push out this content. Let's try for 175 like button hits today. Of course, share this video with anyone you know. I'm trying to reach 10,000 subscribers this year. Hit the notification bell and leave your comments down below. Alrighty, we do have several things to take a look at today in terms of news. A couple things that are not necessarily news. A couple of more thoughts than news. We'll get to that in a little bit. One of that does have to do with bird flu and viruses in general. Then we're going to take a look at some data and maybe some wastewater sites as well. This should not go over 20 minutes today. Starting off in Virginia, Metro Richland Zoo reports that a positive bird flu case has been found. And it says the risk to the public is low at this time. So, yes, Metro Richmond Zoo is dealing with 2 cranes that died of bird flu at the Metro Richmond Zoo, making the first positive test in the zoo's 30-year history, according to zoo officials. Taking a look at this now. In Ontario, this is the Collingwood General and Marine Hospital. I'm pretty sure we've reported on this hospital several times, or Collingwood in general. They've had a lot of COVID outbreaks at their hospitals, and well, they're having another one. Hospital in Ontario. This was posted to my website by Steve just a little while ago, 3:49 p.m. Eastern Time. And get this. Hospital in Ontario suffers COVID-19 outbreak. They are going with mask required. Yes, let's read. A COVID-19 outbreak has been declared on the surgical unit of the Collingwood General and Marine Hospital, a hospital in the province of Ontario. Visitor restrictions are in effect for the surgical unit, and visitors are only permitted for life and patients. In other words, if someone's about to die or not going to make it, as a precautionary measure, universal masking is mandatory on both the surgical and medical units. You know, I would say one other thing, though, or at least if I was in charge of the hospital, why not just make masking be mandatory in the whole hospital right now? I mean, the outbreak could spread to other units, right? This includes all areas of the floors, inclusive of patient rooms, and both team members and visitors. Again, it should be the whole hospital. They don't even mention the emergency department. I mean, why wouldn't you go to a hospital without a mask right now? It's the peak of respiratory season, for goodness sake. All right, in the United States, this is the weekly COVID update from BNO. New cases last week, 207,014 cases, mind you. It does not include these at-home tests and all those people that just bother to not even bother test. Oh, I just have it. It's just a sinus infection or something. I got news for you, folks. I had COVID, and I rebounded as well. You know, I tested negative for several days, and then, well, the virus wasn't done with me. I tested positive again, and the second go-around, yeah, that started out as a sinus infection that was positive for COVID. I was essentially sick for a month. Started with a mystery virus, which was negative multiple times. Then I was fine for Christmas Day. Then a few days later, positive for COVID. That lasted a few days, then negative, and then second go around lasted even longer, with still a few issues that continue today. So, yeah, even if it's just a runny nose, a cough, whatever the case may be, test for it, please. Admissions in the hospital, 14,491. People were admitted in the hospital, 12,386. That's actually up by 3%. In the ICU, 1,735. That is up by 6%. Remember, hospitalizations lag. So cases drop first. Actually, maybe wastewater and cases drop first. Then the admissions start to drop. Then the number of people in the hospital start to drop. Then the ICUs drop. Then the deaths drop. So get what I'm saying here. So now that the cases are dropping, the number in the hospital and the ICU will drop next. But what probably will not drop for at least a few more weeks, maybe we'll say some point in early to mid-February, is the number of deaths. 910 new deaths were added this week. That's up a bit, and the average is now 674, up by 14%. Would not surprise me if a week pops up where we do hit 1,000 deaths. Could be next week. Maybe it won't happen. I hope it won't happen, but just based on where we're heading here, there's a chance it may potentially happen. All right, taking a look at this in Texas, Cisco, Texas. School has been canceled until Thursday. Why? Well, too many people are out sick right now. Yep, they just have too many sick staff, sick students. So because of that illness, school is canceled. Taking a look at this in Montana, I believe this is Butte, Montana, B-U-T-T-E, Butte, Montana. Montanians are no stranger to harsh winters, but this season has brought an invisible threat that's striking fear across the state. I love it. Just cracks me up when they put these articles out there that sound oh so scary. Emergency rooms are seeing a steady intake of patients with respiratory illnesses, leaving residents wondering what's behind the spike in tragic deaths. I'll tell you one thing, we're not taking these viruses seriously. Maybe if we took the viruses serious, guess what? Maybe we would actually be doing better and we wouldn't be having all these problems. Health officials have been tracking the outbreak closely, warning that this year's wave is different, more aggressive, and unpredictable than usual. And that's actually true across the country right now. What lies ahead, at least for COVID, is very unpredictable, and maybe some of the other viruses as well. It is very cold right now in a lot of states, and that is keeping a lot of people indoors. That could be a problem. In Arkansas, extremely contagious disease sees a 680% increase. What's that disease, you might be wondering? Well, we've seen a lot of states report triple-digit increases like this in percentage for whooping cough. Yes, Arkansas is seeing a big problem with whooping cough. Numbers are rolling in from 2024, and Arkansas, as well as most other states, are seeing an increase in the ongoing outbreak of whooping cough. Yes, it has been really bad, and Arkansas reported 299 cases in 2024 versus just 38 in 2023. So, yeah, that's really bad. And it also says here in December, 1 week, they saw 13 new cases reported in just 1 week alone. So, yeah, little old Arkansas is even dealing with flu problems at this time. Canada, taking a look at this, it looks like Canada at this time estimated infections this week. Wow, this is bad. 363,700 to 471,200. 1 in every 61 people infected compared to the lowest point of the pandemic. Infections, 11 times higher. Long COVID, 12 times higher. Hospitalizations, higher. Even deaths, apparently, are higher. And take a look at this. It actually looks like here in Canada, things may actually be, or at least at the end of this chart here, are starting to go up a little bit. So that's not good. Taking a look at this, and yeah, this is not good. The United States, unfortunately, has intended to withdraw from the World Health Organization. And this is kind of a two-part thing we're going with here. Yeah. You know, we had Inauguration Day yesterday for new President Donald Trump. And, well, this is his second term, and he's pulled us out of the World Health Organization. Not really a good time to do that, and quite frankly, you're probably seeing the title of today's video, and you're probably going, this is why he put that title. Yeah, this is why I put that we're just not prepared for another pandemic. We weren't able to contain the current one that started in 2020. Let's face it. Yeah, the vaccines came along. Yes, they did save lives, but they did not stop transmission. There are still new variants forming with COVID. And right now, at any given moment, I just tweeted this a little bit ago, posted this on X a little bit ago. H5N1 at any moment could jump to human transmission. Could be today. Could be tomorrow. Could be a few years from now. But at any moment, it could happen. We need a team that takes the spread of viruses serious. Right now, we do not have that team, and then I put we are screwed. It's true. We do not have that team right now. Look at bird flu. I'm constantly posting new bird flu outbreaks in animals. I'm constantly documenting them on my site. Things are not good right now. At any given moment, this virus, or heck, another virus could pop up and quickly go pandemic. And guess what? We don't have a team right now that is going to take that serious. We're just letting things do whatever they're going to do. And that's not good. I'm very concerned. If H5N1 goes human to human, we don't know. Number one, we're not going to know how transmissible it's going to be. We don't know if the death rate's going to be same as past death rates that we know or were told about in humans. We just don't know. There's so many unknowns, and here we are. We're just going to say, well, let's just wait and see what happens. I mean, we're not going to do anything about it. We'll just wait and see. If it happens, then maybe we should have to do something. I mean, it might be too late, but no. We need to take action now and do something about this, because this is ridiculous to just keep waiting around and finding out what happens. We did that with COVID, and now millions of people are disabled. Deaths are well over 1 million in the United States. Around the world, millions and millions of people have died of COVID. We don't know the actual number, and we do know that a lot of excess deaths can be related to something caused by COVID. It's ridiculous. We need to take these viruses serious. We need to get a handle on what's going on with bird flu. And I got news for you folks. Those who voted, I'm sorry, I hate to get political. Those who voted because, well, with Trump, the grocery store prices are going to be down. If we don't get a handle on H5N1, I've said this a lot lately. If we don't get a handle, no. Dairy products, meat, a whole bunch of things will not be down in price whatsoever, because guess what? Supply and demand. There's going to be a shortage if we keep losing poultry and animals to bird flu. We need to get a handle on this, and God forbid it goes human to human. I'm telling you, it's not going to be taken seriously. We see how much people take COVID as a joke now. You mean to tell me they're going to take bird flu seriously? No, they're not going to do it again. They're just not. All right, in Canada, COVID-19 is moderate. Flu A is high. Flu B is moderate. And RSV is high at this time. Apologies for going on a rant today, but it really bothers me that at any moment we could see things quickly get worse, as if they're not bad enough right now. In Pinellas County, Florida today, taking a look at what's going on right now, and seems to be a lot of unknown problems listed here. Breathing problems is showing up. Not seeing, actually, I was going to say not seeing any sick person calls. There is one at this time. A lot of calls in general. So busy there today. In Philadelphia yesterday, and I do need to put this up on the screen. Let's see. What was the calls for yesterday? Did they report the calls for yesterday? Yes, they did. 814 calls were reported on Monday, as always. I like to tweet that out. Taking a look at what's going on in Montgomery County, Pennsylvania right now. There are a few calls, 15 calls. It's 5:27 at night. We're late with our update today. I'll tell you why at the end of the video. 15 calls, yeah, that is quite a few calls today, and I was out. Matter of fact, I'll tell you now, I was out and about today. I was in the city, and did notice quite a few ambulances today, and I was out. Yes, I did go back to work last night just for a couple hours, and this morning, we'll call it 4 or 5 hours. It was not a fun morning. A lot of icy streets, delivering packages this morning. Anywho, the point is I did see several ambulances this morning, and taking a look at what's going on with the hospital situation in Pennsylvania, I'm seeing yellow in Lancaster, York, Southeast Pennsylvania, Lehigh Valley, yellow at a lot of hospitals. Not a good thing to see. That means there are definitely some issues going on. Lehighton, Pennsylvania, what's going on there? Emergency department overcrowding. All right, hopefully New Jersey is not bad. Let's take a look. I see 1, 2, 3, 4, 5, 6. Yeah, 6 hospitals dealing with patient volumes once again. Princeton Medical Center, high volume of patients. So that's not good. And some of these others, like this one in Bridgeton, New Jersey, it looks like their CAT scanner is not operational at this time. So neuroscience is having an issue. Taking a look at Pennsylvania, and I do need to refresh this. I've been refreshing this afternoon, but it does not look like there is any change in the map on here. And it does say 1-21-2025, so I don't know what the deal is with that. Hopefully on the Thursday update, we will see an update to the map here. I was looking at some of the charts earlier, and it didn't look like to me as if they changed. If they did, there wasn't much of a change. It's supposed to be Tuesdays and Thursdays that updates. All right, national positivity rate for COVID from Walgreens is 12.3%. That is down by 0.9%, but as noted yesterday, we do have some areas rising. And I am concerned what could potentially happen from the Gulf Coast states. They're getting something they don't usually see right now. Louisiana, for example, New Orleans. Last I saw, near a foot of snow. That is just historical. So that's keeping people inside. And we know when you're cooped up indoors, higher chance of transmission. But also, people are not really mixing and mingling. So they're staying indoors at their homes. So it's going to be interesting to see what happens in the South. We could see the drop in the South stall a bit just because of how cold it is. And it may happen in other parts of the country as well. Louisiana, 9.3% positivity rate for COVID. Prior week is 3.4%. A difference of up by 5.8%. Total test, 54 versus 58. I mean, that's just a slight drop in testing. You don't do much to begin with. Arkansas, 13.2% COVID positivity rate. That's up by 2.4%. And total test, 53 versus 37. Missouri, we don't talk about you enough. And you do have an issue going on here. Your positivity rate went up, as did your testing. 19.1% positivity rate versus 15.2%. That's up by 3.9%. And total test, 115 versus 79. And going over to Utah, let's end on a good note with Walgreens. 6.7% positivity rate, down by 1.8%. Total test, 30 versus 59 at this time. All right, now let's take a look at a couple of wastewater sites. We'll do one in the east, one in the west. Then we'll take a look at New York State and call it a day. In the east, Boston, Massachusetts. Take a look at this. COVID rose through the holidays, but then it started dropping right at the beginning of the year. Now we're seeing a little bit of a rise once again. Something to keep an eye on. I don't know if that is going to be something that gets corrected later in the week, but it is not good. RSV at this time is running high. It is dropping. Influenza A still rising at this time. And influenza B is actually starting to drop at this time. And HMPV is still rising at this time as well. Norovirus in Boston is still listed at very high. And take a look at this. It's actually still rising at this time. So that is relatively concerning. Now let's go out to the West Coast and let's do a check of San Francisco. Curiosity's got the better of me. I would like to know what's going on there. We'll go to the southeast side if we can. And we can see COVID is listed at medium. But take a look at this. It actually rose a little bit in the last week. So that's something interesting. And now it's slowed off. It is listed at medium. RSV is low. Influenza A is high. HMPV is low. Norovirus still listed high. And it's actually started to go back up once again. So that's concerning. All right. Now taking a look at what's going on in New York State. 737 tests have been reported. But take a look at this chart. You can see. It went up, it peaked, it started to drop, and it actually went up a little bit again. And what's going on? It's not doing the traditional drop like it would. You could see last year, after the holidays, it did go down, straight on through to the start of spring. This year, though it's not as big of a wave, it's kind of going not down at the moment. I mean, so that's something we have to. Today, New York State reported 876 hospitalizations. Again, this is lagged from last week. We won't start the new week's worth of data for hospitalizations until tomorrow, so we'll have to see what happens there. Overall, they were dropping. Wouldn't surprise me if they come in a little higher tomorrow. We'll just have to wait and see what happens. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. We will have another Virus Update again tomorrow. If you enjoy this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And of course, ways to support the channel and my work here are listed down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.